We here at the Infographics Show routinely cover the most pressing scientific questions of our age, such as what would happen if everyone on Earth screamed at the same time, or what if everyone went blind for 10 seconds. Occasionally, we like to get silly and talk about Link's love life in The Legend of Zelda, or taunt our favorite guinea pig by assigning him the most ridiculous challenges. But that's what makes our channel so fun. And while our teams of world-class researchers, historians, and philosophers are often busy finding new interesting topics to explore, we absolutely love answering questions directly from you, our viewers. Today, we're going to be answering a question asked by Khalil, who emailed us asking about the most painful illness known to man, trigeminal neuralgia. So let's get to it. The trigeminal nerve is the fifth cranial nerve, and it's the largest. This nerve is responsible for transmitting sensory data from the face to the brain. The cause of trigeminal neuralgia is mostly unknown, but many doctors believe it has to do with compression to the trigeminal nerve, causing chronic, excruciating pain in the face. There are three branches of the nerve where the pain tends to be located: the ophthalmic, located in the forehead, the maxillary in the cheek, and the mandibular, which is located in the lower jaw. Pain typically starts in the ear and makes its way to the jaw later. The pain can last anywhere from minutes to hours and sometimes even days. It can make simple, mundane tasks like brushing your teeth, shaving, or putting on makeup extremely unbearable. You can't even smile or chew food without triggering the distress. Sometimes even talking is impossible. The average age of diagnosis is between 50 and 80 years old, with the majority of sufferers being women, though there are many patients diagnosed with this condition who do not fit into this category. One woman named Keisha Bush was only 25 years old when she was diagnosed. She has been interviewed in documentaries explaining how she cannot work or take care of her child because of the intense pain. Symptoms of the disorder tend to be very specific, often described as a sudden onset of severe pain. Now, when we say severe or excruciating as it relates to this condition, we're not just putting this lightly. We're referring to the type of pain that can have you completely incapacitated. People who have gone through trigeminal neuralgia explain it as a sharp, stabbing, shooting, almost indescribable type of pure agony. Imagine the sensation of having needles or even knives driven into your skull. Ouch! This pain tends to be electrifying and usually occurs on predominantly one side of the face, consistent with the area of the fifth trigeminal nerve. Diagnoses of trigeminal neuralgia can be very easy if you know what you're looking for, and it's usually based on the history of the patient, which is sufficient enough to determine this condition as the problem. Unlike many other ailments, this condition doesn't typically require the use of elaborate tests to figure out its diagnosis. In a perfect world, the patient simply points to the part of the face that's been causing them the distress, and the doctor can simply tell by examining which area it's coming from and attribute it to the fifth nerve. However, this condition is very often misdiagnosed as dental pain, TMJ disorder, or a couple of other similar disorders with the abbreviation SUNCT and SUNA, which tend to involve edema of the eye, lacrimation, and nasal congestion. Misdiagnosis usually occurs because the condition is extremely rare, with an incident rate of about 12 cases per 100,000. For this reason, many doctors may not even be aware of the illness. So then how is a condition treated when the proper diagnosis for it is made? Doctors typically revert to the use of an anticonvulsant, a medication normally given to people who have seizures. Specifically, the medication known as carbamazepine is the preferred drug of choice for trigeminal neuralgia. If that doesn't work, doctors may try phenytoin or gabapentin. Because we know you're well versed in the complex names of pharmaceutical medications, and you can probably pronounce them better than we can, you likely know exactly what they are. Another treatment method relates to neurosurgery, which can either be non-destructive or destructive depending on the severity. Non-destructive methods include microvascular decompression, a fancy term to describe a procedure where the nerve is separated from the surrounding arteries or vessels that may be causing compression. The destructive surgical method, which is sometimes necessary, refers to causing purposeful damage to the trigeminal nerve so that it can no longer transmit pain signals. The loss of pain signals may sound nice, but it also involves certain consequences, such as loss of other sensations. For instance, you may no longer be able to feel the gentle hand of a loved one affectionately stroking your cheek. Before surgery is utilized, the patient must have exhausted all other options and forms of treatment. Usually, an MRI of the brain must first be used, as well as having a consultation with a neurosurgeon. As you can probably tell, it's an extensive process, which can greatly rack up your medical bill. Hopefully, you have some good insurance. This disease doesn't always have a simple fix, however, and it's often nicknamed the suicide disease for good reason. As mentioned at the beginning of this video, it is the most painful condition a human can experience outside of being externally tortured. It can drive drive many sufferers to take their own lives just to escape the enormity of the awful feeling. But it may not be just the pain that can push people to consider suicide. There may also be certain social implications. For those who don't have trigeminal neuralgia, it may be difficult to understand why it's such an ordeal. Pain in the face? Big deal, I go through that every time I get a root canal or get punched in the face at my local bar. Facial pain may not seem as bad as other more visible problems, so others may not be able to relate or comprehend why someone can't function normally or go to work just because of this kind of discomfort. As a result, many sufferers may be susceptible to ridicule. People around them might say, "Oh, you're just using this as an excuse to not work, so you can lay around and do nothing all day." We here at the Infographics Show would like to remind everyone that you never know what someone might be struggling with unless you've gone through it yourself, so it's best to resist jumping to judgment if you can. Still, many people may be critical of others' circumstances, which can lead to the negative connotation of being labeled as lazy if you don't work, even if you have a valid reason for it. So not only are sufferers of trigeminal neuralgia undergoing severe pain, but they may also feel hopeless and useless with their situation, along with the additional effects of the negative social stigma surrounding them. If you know anyone with this condition, be kind. Perhaps understanding the extent of their pain will help you become more sympathetic of what they're going through. Feeling freaked out after that? Still in the mood for more? Then we've got just the thing for you. Go watch the most painful animal attacks humans could ever endure right now. Compare it to trigeminal neuralgia and tell us which you think is worse in the comments.